Maria, what is your question?
Hi. I live in New York City. I'm a lifelong New Yorker, mother of 3 children, and we are in the midst of a mental health crisis and a substance abuse crisis. I was sucker punched in Central Park just walking my dog by someone who seemed to have no idea that he was even engaging in a violent act. And we've had some really serious fatalities. A woman was thrown on the subway to her death, Michelle Go. Just this past weekend, 2 small children were attacked randomly by somebody who was having a mental health crisis. An EMT worker was stabbed recently. And it's obvious to anyone who lives in New York that our government is just not taking care of this, and that people need help. They need services. They need treatment for their mental illness, but we're not doing enough about it. And so, my question is, what can we do? How can we get our elected leaders to do more to take care of the people who so desperately need help?
Now, to be fair to the context of the question, can't ask Mayor Adams because he didn't want to come tonight. And again, it's not a shame game. I like Mayor Adams. He's a good guy. He's popular. But again, it's your city. You're going to have problems. You have a chance to talk about it. You should. Mayor Bronin, the take on mental health is we're starting to talk about it, where we don't just say everybody's crazy. We're treating it like it's a health issue and that we should be sensitive to it. But there's still this cultural resistance to forgiving someone for doing something wrong just because they're mentally ill. And I think that's been a real obstacle in helping. So what have you seen in Hartford in terms of what you do with mentally ill who commit crimes, which, by the way, is a very small number, right, just to deal with prejudice? The mentally ill are statistically much more likely to be victims of crime than they are perpetrators of it. But the perception is out there. How do you address it?
First of all, thanks for having me on. Mental health is an incredibly broad category, an incredibly broad term, and it includes a lot of things. I think it ought to include just the fact that we're seeing more and more people having trouble managing their emotions. You see that on airplanes, you see that in road rage, you see that showing up in so many different ways. That's a mental health issue, and we have to talk about that and we have to address it. And then you have the much more acute type of mental health, diagnosed clinical mental health problems. And as you say, Chris, and I think it's a really important point, vast majority of people with mental health issues are not violent, but there are people who are. There are people who have an extensive history of violence and an extensive history of diagnosed mental health issues. And too often in our country, the only place where those people get any treatment for those issues is in prison. And they should get treatment when they're in prison. I think they should get better treatment than they're getting when they're in prison. But the real problem is that when they come out, they don't get any. So you have so many examples of people who are on meds and managing when they're in the correctional system, and when they're out, they fall apart. And it's devastating to their lives, and it becomes dangerous to communities. And I do think that this is, as a nation, across the country, a failure of systems and a failure of us as a society to recognize that we have to do more. And I think in some cases that may mean that you have to compel people to get treated. And
what does that mean?
Well, someone described that New York has attempted to attempt this.
The Democrats are very quick to push back on people's privacy rights and HIPAA laws, and that you can't make somebody and you can't take away their power like that. It's been an obstacle to red flag laws more on the left than the right. What do you think?
Rightly so. But at the same time, I think somebody, I don't remember who, in talking about what New York was trying to do in this area, said, that it's not coercion, it's compassion when you're helping somebody who needs treatment get treatment. And I think that was really well said. I also think that we have to recognize that this will take an investment of resources. Right now, we don't have the places that have the capacity to provide this kind of support. Emergency rooms aren't the place, but too often they've become the place. Our police, if they see somebody who's repeatedly threatening people in the community but hasn't yet committed a crime, they don't have a lot of options. Sometimes the only option they have is to bring somebody to an emergency room for a short period of time. And oftentimes, that emergency room, which isn't equipped to deal with that challenge, will say, we don't have a medical reason to hold this person, we're going to let him out. And then you have no answer because there are not the places, the facilities, the support structure in place to deal with that. Now, there's a whole spectrum of things you could be doing. We should be doing a lot more on supportive housing because not everybody needs to be in an institutional setting. A lot of people who can actually live independent, healthy lives if they've got that support. And that's an investment well worth making because it's a fraction of the cost.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.